very good evening to our viewers. Welcome to the Evening Review Show. I'm your host, Matthias Haufiku. Well, we know it's weekend fever, but of course, national affairs don't take any weekend. That continues. We've seen a spike in cancer cases over the years. And of course, we know that the Cancer Association of Namibia has been working around the clock to ensure that that spike is contained and reduced where possible. Recently, the association saw the launch of the Palliative Care Namibia Centre. And we have tonight in studio Dr. Gerrit Keyter to just speak about Palliative Care Namibia, what it's all about, the work you do, and why it's important to have a centre of this nature running in Namibia and how it came about. Good evening, Doctor, and welcome.
Good evening. Good evening to the viewers. I'm very glad to be here to be talking about Palliative Care Namibia. So let me introduce myself. I'm Dr. Gerrit Keyter. I'm working as the Head of Medical Services at the Cancer Association of Namibia. As you all know, the Cancer Association of Namibia, it's a long-running NGO in the country and has assisted so many patients with cancer in the country. And now the next big project which they embarked on is opening the new Palliative Care Namibia Centre, which is also called Huis Zietsman, named after the very famous doctor in Windhoek, Dr. Zietsman, who's been working in oncology for so many years in this country, and who also advocates for the need and the dire essence of palliative care services that need to be developed in the country. So, like I said, I'm the Head of Medical Services at Cancer Association of Namibia, and one of my main focuses is heading Palliative Care Namibia. Palliative, it's a very fundamental aspect of medical care, but it's an aspect that not a lot of people are aware of, and especially in sub-Saharan African countries, palliative care is not where the services should be at all, and we mostly see it in the private sector, especially in South Africa, but in other sub-Saharan African countries, it's really lacking. And there's a huge need for developing palliative care services, especially in the state sector, in the Namibian healthcare sector, because we're seeing a lot of patients, especially in the northern parts, where you get very old and frail patients diagnosed with cancer, which are terminal, and then there's no facilities to assist these patients. And then the family members cannot also not assist these patients. And it puts a lot of pressure on the family members. It puts a lot of pressure on the public healthcare services, actually. And then you see a ward where you get 40% of your medical ward is full of frail care patients, which are actually supposed to be in a palliative care centre. So that is where we stand with palliation in this country. There's a lot of development that needs to take place, especially in the rural areas, and that is why the Cancer Association of Namibia embarked on this huge challenge, but a very important aspect of healthcare that is currently lacking in the Namibian healthcare sector.
People will be wondering, what would the difference be between a palliative care centre and your normal ward in the hospital? What is the difference? What's different when I'm in the palliative care centre?
That is a question we get a lot. And one of the biggest obvious differences is it's not a clinical setting like a hospital. It's a much more homier environment. And it's got this, it's developed, it's like, for example, at Huis Zietsman. It was an old house that was actually donated to the Cancer Association. And then the ward was developed around that. So it's got this homey feeling. It doesn't feel like your normal clinical hospital ward. And patients have their private rooms there. They've got an outside garden where the carers take the patient. It's a peaceful setting. So it's a much more friendlier environment, which actually focuses at the end of the day on improving quality of life for your patients. And that is the main focus of palliative care, because palliative care is essentially improving the quality of life for not only terminal end-of-life patients, but for any patient who is diagnosed with a critical, long-standing terminal condition from day one of diagnosis until the last day. And palliative care entails all of the services which is needed to care for a patient like that.
Yeah. So how does the public access these services? What needs to happen?
That is a challenge we are facing, especially, like I said, in the public sector, because it's lacking in the public sector.
Yeah.
For example, in Cape Town, at Grote Schuur Hospital, they've got which is a public hospital, they've got a department for palliative care services. But it's also only in Grote Schuur, and the bigger hospitals in the other regions or in the other provinces are also lacking these services. And unfortunately, at this moment, we mostly find these services in the private sector, because that is where the development, or that is where investment is made into palliative care. And this is what we also have in Namibia at the moment, because Zitzman, it falls under the umbrella of the Cancer Association of Namibia, like you mentioned. But it's still a privately run clinic at this point of time. And the main goal is to eventually develop the services, that we can take these services to the state sector and then roll out the state care program in collaboration with the private sector, with Zitzman and the staff there. So patients are treated by the treating doctors, usually the physicians, the cardiologists, your internal medicine specialist, and then your oncologist, and then they refer these patients to Zitzman. And after the referral, we have a very in-depth interview with the family and also with the patient, and then we admit the patient in that sense. But for now, we can only admit the patient once we get a referral letter from the specialist. Yes.
Okay. Tell me a bit about the situation on the ground. I mean, you deal with these cases every day. Is it something that can be brought under control, or because everyone is wondering why is there a sudden spike in cancer cases? Has it always been there, or is it a new phenomenon?
That is a very good question, and that is what we are debating about at this moment. We do have improved screening services, picking up cancer cases much earlier, in especially younger patients now in your rural areas compared to previously, because there's more staff now, and the program is being run, it's being brought out into the regions. So that's definitely one of the factors that we're seeing in Namibia, but there's a lot of lifestyle factors like I said, the modern lifestyle is actually not good for your health, and that enhances cancer development. A lot of stress that we're having in this modern age, a lot of smoking. People are smoking a lot. That is not a good habit to have. A lot of cancers arise from that. Very poor diets, especially there's a deficiency in micronutrients, especially in the rural areas, and also with the droughts. The droughts also actually makes it worse nutritional wise, and that is where nutrition has a huge impact on cancer development. And we see that on a daily basis in Namibia. And then also there's factors like hormones, and we're seeing a lot of very younger patients being on hormone treatment and taking contraceptives, and this especially has an influence on breast cancer development. And then also with the water that we consume, there's chemicals in that, and there's a lot of environmental factors that also causes us to have this increase in cancer cases. So yes, unfortunately the modern lifestyle, we think it's good, but we do see it in rising cancer cases. And unfortunately, cancer care is incredibly expensive in this country. And that is why there's such a need for palliative care. Because of...
So as far as the cost is concerned, how do we compare to other jurisdictions?
It's cheaper. That is one of the benefits about palliative care, and that is also what the WHO is actually, they want to roll out more palliative care services in your lower middle income countries, because it's much more cost effective. At this moment, we've got the private sector and we've got the public sector in Namibia, and in the private sector at this moment, cancer treatment is really expensive. And unfortunately, not a lot of the patients have access to this treatment.
Yeah.
And then you get cases in the state where it's really advanced cancer, and we can't do anything much about that because we don't have the treatment available in the state. Even pain medication, which is a fundamental point in palliative care services, isn't available in the state sector at this moment. So yes, it's very expensive keeping your patients for long term in a hospital setting, in an ICU setting. And that is what we are also seeing at the center, that the cost benefits are just massive if you compare to what they're getting, what they're actually paying in the hospital setting at this moment. Our Zitzman, like I said, is a private facility. And they do it there. It is, you need to make an upfront a payment if you don't have medical aids, but compared to your hospital benefits and the cost for these treatments, it's much more cost effective.
Okay. In a statement that the Cancer Association of Namibia sent out earlier this week, they spoke of health benefits of timely palliative care implementation with over-treatment. Can we perhaps just expand on that a bit?
Yeah. So yes, it's the health benefits. At a certain point in a terminal condition, you need to outweigh the benefits of the treatment the patient is getting, and if the patient is not getting the treatment. And if you reach a certain point in the prognosis of the pathology, then over-treatment is actually doing more harm for your patient. And that is where palliative care services advocate for earlier intervention, earlier transfer to palliative care centers, because at the end of the day, we want to improve the quality of life and the dignity of this patient and not harm them with harmful medication. And that is where the discussion starts coming in with the palliative care services and with the oncologist and with the treating doctors. Because somewhere a call needs to be made that this patient is a fully palliative care case, and now we're focusing on improving quality of life for this patient. So that is one of the main health benefits. And the other thing is pain management. And that is what we're seeing, especially in the state sector. We're having a lack of morphine, for example, pain medication. And when you reach a point in the pathology, the pain is so excessive. And treating this pain improves the overall psychological health also of this patient. Because treating pain is it's not only physical pain, but it's also mental pain, it's also social pain, it's pain overall. And then this improves your quality of life of your patient at the end.
Okay. Well, Dr. Keyter, we head for a short break and we'll be back to continue this conversation. To our viewers, we head for a short break. Stay tuned. Welcome back from that short break. Dr. Keyter, you mentioned earlier on that there seems to be a spike also in the rural areas as far as cancer is concerned. And we've spoken about the cost of this treatment. So how does is there a way to balance this? How do we find middle ground where those who suffer from this condition can still access quality health care?
Yeah, so that is what we were talking about earlier, of actually developing the palliative care program in the state sector, because that is where the huge need in this country is. And that is where most of the patients are. And one of the main MOUs of the Cancer Association is to develop and train care workers and palliative care nurses, especially, that work in these regional centers. Because if you've got these nurses and care workers based in your regions at these local facilities, then they know what to do. They've been trained by the facility, and they've got access also to this network of doctors and nurses in the country, which can also help them. But then you get your home-based palliative care nurses going out to the homes and then enforcing or implementing this care. So that is what they were doing in the Western Cape, for example, because the palliative care program, which started there, was a nurse-led program in Groote Schuur Hospital, and then it developed, and then they trained nurses and they trained carers. And now you get this whole network in the province, for example, where they've got carers and nurses at the local clinics and communities, and they've got access to the nurses in the hospital, and they can call them, they can WhatsApp them, they can ask them for advice, but then you can actually treat your patient where the need is in that community. And that is the future plan eventually that Palliative Care Namibia also entails, that we especially develop these services in the rural areas.
So perhaps from the perspective of the members of the public, many still feel that they get to feel that cancer is a sort of a death sentence, because it's been so deadly in recent years, and so many people have passed on because of that. What is your take on that, and how should that be approached?
So the treatment for cancer has definitely improved over the past years, and there's so much research going into cancer treatment, and we're seeing there's such a spike in knowledge about cancer treatment. So that has definitely improved, and we don't have to say that it's a death sentence anymore. But but like I previously spoke about, the factors of why there's a rise in these cancer cases, lifestyle factors, environmental factors, and then also, like I said, also we picking up earlier during the screening processes. And if you pick it up very early in the screening processes, and that is why going for your yearly checkups, going for your pap smear, going for the prostate exams, going to your GP for your general examination on a yearly basis, and doing these tests and go for the screenings, you can actually pick up the cancer much earlier. And then when you pick it up much earlier, the treatment is so much better. So that is what we also, as at the Cancer Association, that we encourage that people go for their screenings and see their doctors and talk about this, because especially in the male population, we're seeing there's a lack of, I don't want to say knowledge, but there is a lack of there's a lack of the health-seeking behavior is poor. And then you start picking up cancer cases at a much later stage. And then it starts getting much more difficult to treat the case. So the earlier we detect the cancer, the much your prognosis is much better. And then, like I said, it's not a death sentence, it's a treatable condition, and you can actually live many years in remission. Yes. So again, I'm advocating, go to your GP, go do your screenings on an annual basis and get checked out, because that's where you pick it up very early.
So maybe from a personnel and skills perspective, how is Palliative Care Namibia doing in that regard?
So the screening, what I was talking about, that is mostly done by Cancer Association of Namibia, and they've got the staff trained to do these screenings. Palliative Care Namibia focuses more on the palliative care aspect. We don't do the full screening of these patients, but we do assist them if they need assistance. But our main focus is treating or admitting our palliative care patients, advocating for these patients, health education, talking about what is palliative care, spreading the word, and developing the program, or this national program of palliative care network, which we can enroll in the regions.
Let me just shift the conversation a bit, and I don't like comparing things, but I think it sort of ties in with this. I remember in the 90s and the early 2000s, when HIV was so prevalent, there was a lot of public campaigns and noise being made as to how to sort of prevent this and so on. Do you see the same energy and zeal in the fight against cancer?
Yes, I do. And there's a lot of similarities with those days and with now comparing it to also to the cancer. And there's one of the main things, especially in the African setting, is the cultural aspect and the beliefs around certain diseases and and then traditional medication involved. So in that we also saw, I was I was still very young, but from what I'm hearing from my peers and from the senior doctors, that they had the same cases with the HIV pandemic in the 1980s and early 1990s. Yes, and there's also a lot of conspiracy theories going around, and there's a lot of myths going around, and people reading the wrong literature and the wrong information and spreading this information, which is actually not correct. And therefore you what the doctors say, and there's a reason they go to medical school for that long time and then go and specialize, because it's a very scientific field and it's evidence-based medicine, and they've got the research going on, and you can advocate this research and spread this research. Yes, there are similarities with cancer now compared to HIV. And just to actually also HIV, for example, that is also, if you're in a very critical condition now for these cases, that's also your palliative care cases, because they're in such a critical condition at the end of life. Then you admit them to a center, and they get specialized care in these centers, and we focus on, like I said, the dignity and the quality of life of these patients until the end.
Okay. I think another thing is, before we start wrapping up, there's always been this perception around cancer that it's not more prevalent within the black community, it's more prevalent in the white community. How do we dispel those type of notions? And what do you think sort of breeds those type of conspiracies, if I may call it that?
Yes, there are a lot of conspiracies like this going around. I can tell you in Namibia, it's as prevalent in the whole population. It doesn't matter what race you are. We do see certain cancers are more prevalent in certain races compared to others, but it's there. We just were not looking for the cases earlier, and we were shying away from cancer cases in a lot of the communities. One of the reasons also is cancer, with the history and mostly in private sector, you were doing your screenings much earlier and picking it up much earlier. And that actually caused this mentality of people thinking that a certain type of person will develop cancer, and I'm not going to get that. But as we see economic advancement and social advancement, the middle class is growing, everyone is getting access to, or more people are getting access to private doctors, for example. And then you start seeing cancer cases are everywhere. And it doesn't matter who you are, you can still get cancer. And it's prevalent in what we're seeing now actually is a rise in younger people. A lot of younger patients are getting cancer, or we're picking up cancer, and then it's very severe cancer that we're picking up in these cases. So yes, I believe there's a lot of socioeconomic factors that played a role of why people thought of certain people developing cancer in the past, but now people, middle class growing, people getting access to medical care, the healthcare sector in the regions also improving. Now you start seeing that it's actually, it doesn't discriminate.
It's across the board.
It's across the board.
Yeah. Okay. Palliative Care Namibia is there now. What is next for the Cancer Association as far as this fight against cancer is concerned?
There's a lot of projects going on, but the main thing now is to get the Palliative Care Centre up and running, get us more patients admitted to the facility, educating the public about what is palliative care, how we can improve the services in Namibia, the dire need that actually exists for palliative care. Cancer Association, we are opening a new palliative care centre next year, February, March, in Swakopmund. which is going to be the Erongu Centre, the Erongu Palliative Care Namibia Centre. And then later on, there's also plans to develop the Palliative Care Centre in Windhoek West. And there we will mostly accommodate, we first need to get the private patients up and running. And then when we've got that financial back, then we start rolling out the state sector, the state, leg. And then we're going to working with the state, with that centre, to assist our state patients with palliative care services. And then, of course, to develop the regional palliative care services as well.
Okay. So what is the end goal as far as these centers are concerned? Would you like perhaps to have in each region one, or what is the vision of
that would be the ideal. That would be that would be the ideal, if there can be a palliative care center in each region, even in each town. But we know from a cost perspective that's not the reality, and that is why we focus on developing this regional training, or sending people to the regions and training them there, so that you've got your local staff that are trained with these skills, that they can actually take on the services there. But yes, the ideal would be having a lot of palliative care centers, but for now we've got the one in Windhoek East, in Klein Windhoek, and then we're opening the next one in Swakopmund next year.
Yeah. Well, Dr. Keyter, thank you very much for your time, and we wish you well with your work going ahead.
Thank you.
Thank you, and all the best. Thank you. To our viewers, that's it from the Evening Review team. See you again next week. Have a pleasant week ahead. Thank you.